The team at Florida Pain Relief Group are back today with a great message of how they can help ease your shoulder pain. Dr. Rudy Gary joins us this morning. Welcome back.
My pleasure.
So yeah, let's talk about shoulder pain. I feel like this is a pretty common issue that a lot of people are facing, but what's the major causes, do you think, of shoulder pain that you see?
So your shoulder is a large joint, and as we get older, that lubrication and that rotation gets more and more difficult. So usually the typical cause is inflammation. We do something that we injured that joint, and that inflammation can cause pain, making it very difficult to just move your arm around.
Is it more times than not one thing that we're doing, or is it a repetitive motion if we have careers or something that may have us doing kind of the repeat motion? Yeah,
usually it's more common in patients that are in industries where they have to use their arms a lot, shoulders, and that repetitive motion, lifting heavy weights. A lot of those things can cause significant injury, inflammation, and can just lead to pain. Sometimes it's just normal wear and tear. You get arthritis in that joint like we get in all the other joints.
You hear the term rotator cuff a lot. What does that have to do? Kind of explain where that is in the shoulder, why that gets injured, why people are suffering from rotator cuff pain.
Sure. So the rotator cuff, the shoulder joint is actually one of the most complex joints in your body. If you think about everything that it has to do, all the different types of movements. So the rotator cuff actually acts almost like a cushion, like a lubricant cushion that allows you to move your arms around, up over your head, back, sideways, and because of that, any movement that can cause injury can also cause an injury to that rotator cuff.
I can imagine when you say something's complicated or it's got a lot, that means a lot of things can go wrong with it.
There's a lot of bones that meet to form that joint, and then that rotator cuff is right there in the middle of it, trying to make sure that we're moving in the right direction.
So let's talk about the good news, though, is for those who are suffering from pain in this particular area. How is it that your team is able to kind of treat this and help with the pain for patients?
So the first thing that we'll do is performing an examination. We're going to get a thorough history. We're going to perform an examination. We're going to look at the motion of that shoulder. And sometimes we may have to get an MRI because we have to actually look in there. The MRI allows us to look at the soft tissues and to find out whether it's coming from the rotator cuff, perhaps it's a tendon, maybe there's a tear going on. And depending on that diagnosis, that's going to lead us as to what the treatment would be. And that treatment can range anything from just pills, sometimes physical therapy. There's a lot of times we can actually go in there, we can inject that joint with an anesthetic or corticosteroids. And we're even doing some very exciting things such as regenerative medicine, where we can actually inject stem cells right into that joint.
We're going to talk about that even in a further episode. Do you need a referral to come to you guys? I mean, can someone just call up and say, I'd like for you guys to look at it? How does that work?
You don't need a referral, except sometimes if you come see us, you may have a plan that does need authorization from your PCP. We'll try to make that process easy for you and contact your PCP so like that he can obtain the authorizations for you to see us. And
I know sometimes we've talked to before, if someone is thinking they have to have surgery or something, I mean, would you just recommend maybe getting a second look, maybe seeing what some other options may be with your team?
Well, we can treat the entire thing. So we actually have an orthopedic surgeon that's actually part of our group. But we also have sometimes just physical therapy, sometimes just an injection. I mean, we want to be the least invasive possible, but we can take it all the way through with whatever you might need.
Well, I think that's awesome, again, that you really want to make sure people are educated about what their options are. That's why you're a part of our team, and we love it when you're here. Thank you so much. We look forward to having you back.
Thank you, my pleasure.
And of course, if you want to find out any more information, there is their number to call. They have a great website as well, and his team will take care of you. So thank you so much, Doctor.
Thank you.